Hi, welcome to another episode of Facebook Live with Veterinary Referral Center of Central Oregon. I'm Jen Bentley, and I am going to talk to you all about atopic dermatitis and allergies today, which I love talking about as a board-certified dermatologist. It's kind of the main thing that we treat. 90% of our dogs have some sort of allergies, so we become very familiar with this topic, unfortunately. I've got Shelby in the background on the camera, and Denali will be taking your questions throughout the day, but I'm going to start us off with just some definitions here. And I think it's a good starting place with definitions, and then we'll kind of slide into some of the more advanced things that a lot of the veterinarians don't really discuss with you on your appointments about atopic dermatitis and environmental allergies. So we'll be diving into that. So a little bit more of an advanced conversation than maybe we've done before. So atopic dermatitis is actually derived from a Greek word that literally translates to strange disease. And I know if I went to a doctor and they told me I had a strange disease, I would not feel happy about that. And unfortunately, it's kind of true. It is a strange disease. And it turns out it's very hard to control as well. From that, atopic dermatitis, literally kind of our definitions, which change over time. But mainly it means a chronic, relapsing, inflammatory skin disease that manifests also in pruritus due to an abundance, can be due to an abundance of immunoglobulin E triggered by environmental allergens. And I say can be due to an abundance of immunoglobulin E triggered by environmental allergens, because here's the caveat, is not all dogs are triggered by environmental allergens. So it kind of makes things a little bit confusing because we really consider atopic dermatitis and environmental allergies synonymous, but they're not. Environmental allergies can be a component of atopic dermatitis. And that, I think, is important to understand because it also goes into the fact that this is a multifactorial disease. So there's a genetic basis for the disease. There's also an immune dysregulation that most of these pets have. There's also a dysregulation of their skin microbiome. So much like we talk about the gut flora, the skin flora can also become problematic. And this we see a lot of times is manifesting in these chronic ear infections and chronic skin infections. And how do you help the microbiota of the skin to make it so they're not relapsing with these. And then finally, also the skin barrier plays a big role in this. And on the human side, they actually know the mutations that cause skin barrier dysfunction. And there's some hypothesis, it's called an outside-inside hypothesis, where you have skin barrier dysfunction, and that actually literally allows the allergens that are outside those pollens to get on the skin, and then they actually travel deep enough. They break through that skin barrier to activate the immune system. And so that's one reason why these guys are just hyperimmune to the allergens. So as you can see, there's a lot of factors here at play, not just environmental allergies, but different things that go into this disease that we know as atopic dermatitis. And because of that, it gets a little bit confusing to diagnose, right? Because all dogs are going to present differently. And in fact, on the human side, we know that humans with the same genetic mutation, exactly the same genes, they can present differently as well. So many different factors go into here between the interplay between genes and the environment that causes people and dogs to have very, very different, basically phenotypes or different manifestations of the same syndrome. So for example, I'll have dogs with environmental allergies as a trigger and they're presenting with ear infections. Other dogs, it's just podopruritis or itching of the paws. And then some dogs, it's just infections of their groin and kind of a itchy dorsal truncal area. So large differences in manifestations. I have a lot of owners who tell me, well, I've had a dog with environmental allergies or atopy and it looked like this. And this dog, I'm telling them, like, no, your dog has atopy as well, and it looks completely different. And that's a very normal thing, unfortunately, because this isn't necessarily thinking about it as a disease, but more of a syndrome, encompassing a lot of different multi-factors into this. And unfortunately, with this syndrome, it is increasing. And the prevalency is very high. When we think about food allergies versus environmental allergies is way more common than food allergies is. And it seems to be increasing. That is the same on the human side and also on the vet side. Risk factors, there's some risk factors that we know that may be leading to this increase in atopic dermatitis. So there's been a couple studies on dogs with this and what can be a risk factor and what actually protects against allergies as well. So a couple of those things that can protect your animal against developing atopic dermatitis included going on walks in foresty areas, not living in an urban environment, and not being a white dog as well. We see this on the human side too. It's and one thing, if you're a Googler, you can Google the hygiene hypothesis. There's a really nice study that was done on Amish kids versus urban kids on who gets more atopic dermatitis. Amish kids got less atopic dermatitis, and the theory is they're exposed outside. They're exposed to animals, they're playing in the dirt. So as, when we think about risk factors for this, it's almost like, well, you want to get your dog dirty, you want to expose them to different things. And we've got a question already. Denali, what is our first question here?
We have a question from Dawn, and she would like to know if you have any theories on why environmental allergies are increasing.
Yeah, I think it all has a lot to do with the sterility of how we keep our pets and honestly how we keep ourselves. We bathe a lot, we do laundry a lot. So I think that's probably one of the reasons why it is increasing is the sterility of where we have our pets and also our people. There's probably multiple other factors for this. That's probably one of them. Interesting too to highlight that on the food side is it used to be, you don't expose young babies to peanuts, and now that's switching. And a nice study was done in Israel because they give babies, very young kids actually, exposure to this certain type of treat that has peanuts. And they found that these Israel kids do not have peanut allergy when you compare them to Western civilizations. So it appears that early exposure to certain allergens, certain germs, may be very healthy actually for the immune system, which is quite interesting. And hopefully we'll learn, more about that as we go along in all of this. So I hope you can appreciate the complexity of this disease and appreciate, why it can be very, very hard for veterinarians to actually treat this disease. We're lucky. We do have 4 main drugs to treat with, right? So we've got steroids like prednisone, we've got Apoquil, we've got Cytopoint, and we've got cyclosporin. Those are the big 4 drugs that we can treat atopic dermatitis with and environmental allergies. I wish I could tell my owners, like, hey, your dog or cat, you're going to respond to this drug 100%. But I can't say that. It's always a guessing game. Some dogs respond really, really nice to Apoquil. Some dogs respond really, really nice to cyclosporin. We just don't know. And in fact, on the human side, there's research going into that to say, okay, well, if you take this as a syndrome, what genetic defects are going to say, hey, this person is going to respond better to this drug. So I wish we had that type of information because I hate giving, if you're familiar with the Cytopoint injections, they can be quite expensive and really only 70% of patients respond. So it's, I wish we just said, could be a little bit more confident on which patients are going to respond to which drugs and which are going to be the best. But it's a little bit of trial and error there. Of course, the drugs are Band-Aids, right? These are things that aren't going to cure your pet. They're going to be long-term drugs that we use. Atopic dermatitis is never going to go away. It is going to be with your pet forever, and in fact, it's a progressive disease. And if you're familiar with this disease, you'll know that over time, what you'll get is you'll get really thickened skin, you'll get blackened skin. That goes along with the progression of this disease. And I'll stop there. Denali, we have one more question here.
We do. Dawn would also like to know if we can give dogs appropriate doses of Benadryl.
Yeah, so unfortunately, the antihistamines really don't work well in dogs. I've seen them work a few times. By the time they get to me, it's I think I see the worst of the worst, but they're not going to work. So yeah, you can definitely ask your veterinarian about that and make sure you don't have any drugs on board that are going to give drug interactions. But in my experience, the antihistamines really just don't have a good benefit for, I would say, 95% of the dogs. It's always something you can try. They're pretty benign drugs. They really don't cause sleepiness in dogs. My favorite antihistamine to use that I think I have the most success with is Zyrtec or cetirizine. So I would probably go that route rather than the Benadryl for atopic dermatitis. But again, I don't prescribe it very much because I don't find they respond to it, and most of the patients I see are quite severe, and they really need that anti-inflammatory power on board to get them back under control. So going back, this is chronic progressive disease. These medications, whatever you pick, are going to be Band-Aids. And that's where allergy-specific immunotherapy really comes into play. And I don't think this allergy-specific immunotherapy or the allergy vaccine, sometimes I think our general practitioners see it as more of a last resort for these patients. It's really kind of a first step that should be taken because it's the only thing we can do to prevent the progression of the disease and lessen our medications that we're going to use. The hard thing about it is a expensive treatment to start, not to maintain. It's usually about $20, $30 a month for most patients, which of course, if you've used Apoquel, is cheaper than that. Again, we don't know that what patients are going to respond and which don't. It's not 100%. Our goal is to decrease medications over the time by 50%, that's the goal. If we got some animals do respond completely and don't need medications for the rest of their life. That's awesome. Those cases, unfortunately, are few and far between. But I would say 80 to 90% of the dogs are responding, and you are backing off of those medications. And it's always good to back off on any of the medications. Half your dose of Apoquel, half your dose of steroids over the course of your dog or cat's life is going to be beneficial. So that's where the allergy vaccine comes into play. And we're actually going to be talking about that, and I'll show you kind of what's entailed with that and how we make our vaccines in a Facebook Live a few weeks from now. So that'll be fun. That'll be interesting. You can see all the allergens we use, which is I always think is kind of cool. If you have any more questions, please chime in now. And then also ask me any questions afterwards. I could go on and on about the subject of atopic dermatitis and environmental allergies. I think it's completely fascinating. Yeah, please chime in with the questions. And I'm glad you guys showed up for the discussion. And we will be here same time in 2 weeks on Wednesday. Thanks.